New subvariants now account for about 7% of all new infections of COVID infections in New England. Here to answer your questions about that, Dr. Todd Allerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
Hey, Dr. T, great to see you. So right now there is no Greek letter for this yet. When we have them, we'll have Maria pronounce it for us. But it was BA4 and BA5 are both offshoots of the original
Omicron
variant. But how are they different from the other subvariants that are already circulating?
Right. Important question, Eddie. You know, it's probably more similar than different. They really are cousins, or these subvariants of Omicron. And, I think the good news is that while they may be more contagious and they may be able to evade immunity, whether it's natural infection and vaccines, a little better than the prior ones, it looks like they're not necessarily any more virulent in real life. In the labs, surprisingly, they do look like they may be able to infect cells better. So it's possible that it could be more virulent if you are unvaccinated and have never been infected before. So this is a good opportunity to remind each other that it's not too late to get vaccinated. That maybe you may be surprised to hear me say that. And especially if you've been infected before, remember that hybrid immunity where you have a little bit of both. That's probably the best immunity.
Doctor, these two subvariants, they've already triggered this COVID wave, if you will, in South Africa. So what kind of impact did it have on hospitalizations and deaths there? Because we can learn from what happens there here.
Absolutely. The forecasting in South Africa can really tell us and predict what's going to happen in the U.S. And the answer is, while there were a lot of cases, still the number of cases in South Africa weren't that impressive. Now, it's probably an underestimate, like in the United States, because a lot of home testing. But what's clear is there was only a little spike in hospitalizations and deaths really remained flat. So I think that's a good sign. Plus, remember, South Africa hasn't recently seen the BA2 spike that we just saw. Overall, I'm feeling good. I think cases may rise, but I'm feeling like overall the severity of cases are going to remain pretty low, especially if you've been vaccinated or infected.
So, Dr. T, as you know, for people who test positive, there are many new treatments available, including the antiviral pill Paxlovid. You've said it many times. It's effective. It saves lives. But now we're hearing there may be an unpleasant side effect. What can you tell us about that? And do you still recommend it to your patients?
I definitely still recommend it, but it's Paxlovid mouth. The taste, this is a medication that doesn't taste good. Some people describe it as metallic. Some people describe it as bitter. Some people say, oh, I wish it were just metallic or bitter. It tastes like a bad grapefruit that you've rubbed sort of metal on.
Yeah. How long does it last?
Yeah, right. It can start soon after you start taking the medication, but the key is it resolves. Right. And it typically doesn't last much longer than after you take it. That's important. Overall, in the studies, it was between 5 and 6% of patients described it. In real life, my guess is it's a little higher. The bottom line, though, remember, 90% reduction in hospitalization.
There you go.
This medication works.
I was going to ask you for that reminder. The medication itself works, so perhaps you put up with the bad taste for the bottom line that it works.
If I get it again, I'm going to take Paxlovid.
Dr. T, great to talk with you. Thank you.
Be well, Doctor.
You too.
By the way, you can send your questions if you have questions about COVID to ask@wcvb.com, and our experts will answer them. Let's talk about sunscreen now. The weather is getting much